Hi guys, what's up? In this video we'll focus on something called coronary artery disease. So what's coronary artery disease? Is the most common cause of angina and acute coronary syndrome, and is the most common cause of death worldwide. Okay, acute coronary artery disease is common in those who present with other forms of atherosclerotic vascular disease such as intermittent claudication or stroke. Okay, and also is an important cause of morbidity and mortality in these patients. And now let's jump to the pathogenesis of coronary artery disease in the vast majority of the patients. Coronary artery disease caused by atherosclerosis, but rarely it can occur as a result of aortitis, vasculitis, and autoimmune connective tissue disorders. So atherosclerosis is a progressive inflammatory disorder of the arterial wall that's characterized by focal lipid-rich deposits of the atheroma that remain clinically silent until they become large enough to impair tissue perfusion or ulceration and disruption of the lesion, result in thrombotic occlusion or distal embolization of the vessels. So abnormalities of arterial function have been detected among high-risk children and adolescents, such as cigarette smoking, in those with familial hyperlipidemia or hypertension. So during evolution of atherosclerotic plaque, monocytes, and other inflammatory cell bind to receptor expressed by endothelial cell. So in an establishment of atherosclerotic plaque, macrophage mediate inflammation and smooth muscle promote repair. If an inflammation predominates, the plaque becomes active or unstable, may be complicated by ulceration and thrombosis. Cytokines such as interleukin-1, tumor necrosis factor alpha, interferon gamma, and what you call matrix metalloproteinase and platelet-derived growth factor are released by activated macrophage. Here we have clinical manifestations and pathology of coronary artery disease. Clinical problems such as stable angina, unstable angina, myocardial infarction, heart failure, arrhythmia, and sudden death. Pathology for stable angina is ischemia due to fixed atheromatostenosis of one or more coronary artery. Unstable angina. Pathology for unstable angina is ischemia due to dynamic obstruction of coronary artery due to plaque rupture or erosion. Myocardial infarction. Pathology for myocardial infarction is myocardial necrosis caused by acute occlusion of coronary artery due to plaque rupture or erosion. Heart failure, myocardial dysfunction caused by infarction or ischemia. Arrhythmia, alerted conduction caused by infarction or ischemia. The last one, sudden death, which is pathology is ventricular arrhythmia, asystole, or a massive myocardial infarction. Well, here we have many risk factors that have been identified for atherosclerosis, but the causes are incompletely understood. So what are the risk factors? First of all, we have age and sex. Age and sex. Age is the most common, powerful, independent risk factor for atherosclerosis. Well, premenopausal women have lower rates of disease than men. The second one, we have hypertension. The third one, we have cigarette smoking. There is a strong relationship, especially in young individuals. Below 70 years old. The fourth one, we have hypercholesterolemia. The fifth one, we have diabetes mellitus. The sixth one, we have hemostatic factor like platelet activation and high plasma fibrinogen concentration are associated with increased risk of thrombosis or coronary thrombosis. Okay, the fifth one, we have obesity, physical activity, lifestyle, alcohol, and the last one, diet. In the last step, we'll jump to the management. So there are two approaches can be employed: primary prevention, secondary prevention. Primary prevention aims to introduce lifestyle changes, okay, or therapeutic intervention to prevent coronary artery disease. Well, secondary prevention involves initiating treatment in patients who already have had an event with the aim of reducing risk of subsequent events. So now let's focus on primary prevention. Primary prevention, the population-based strategy aims to modify risk factors of the world population through diet, lifestyle advice on the basis of a small reduction of smoking or average cholesterol or modification of exercise or diet will produce worthwhile benefits. So here in population-based strategies to prevent coronary disease, there are some points that you have to mention when you talk about the primary prevention. The first one is don't smoke. The second one, take regular exercise. I mean minimum 20 minutes 3 times per week. The third one is maintain an ideal body weight. The fourth one is eat a mixed diet rich in fresh food and vegetables. The fifth one is the aim to get no more than 10% of energy from saturated fat. So while secondary prevention, this involves targeting intervention at individuals who already have evidence of cardiovascular disease. Patients who recover from clinical event such as MI, myocardial infarction, are usually keen to help themselves, but particularly receptive to lifestyle advice, such as dietary modification, smoking cessation. In addition, intervention that should be introduced in those with what angina pectoris or an acute coronary syndrome. That's all about management. Thanks for watching this video. Hope you get it.